Good afternoon from Belfast, and thank you very much for giving me this opportunity to tell you a little bit about what we're doing on the Connected Health agenda in Northern Ireland. I think the world over, the Irish people would be known as people who have a great ability to talk about things. But for us in Northern Ireland, the period about talking about connected health has gone, and this is a story about action, about just doing it. So let me just tell you a little bit about how we've got to the position where we feel that we need to just do this, to move very quickly towards the scale application of these new technologies. So I'll start with some of the key issues which we were talking about, which we were facing in our health and social care system, and then talk about the policy response to those issues, how we're giving effect to that policy, and then looking forward to developing a connected health economy. And I don't apologize for the emphasis that I'm giving to the policy context here, because in a publicly funded healthcare system, if we're serious about moving towards the scale application of new technologies, the rationale and the push and the strategic emphasis that is given to that strategic drive must be rooted in public policy. So I could have had a long list of key issues here that our health and social care system is facing, and they're not unique to Northern Ireland. I could have included public expectations, I could have included issues about quality and safety, but for me these three issues are the critical drivers in moving towards the scale application of connected health technologies. Starting at the bottom of the list on performance management, if we consider the increasing cost of healthcare and the need for governments to provide above inflationary increases for the healthcare system year on year, the drive for improved performance is not going to go away. That will be with us increasingly, I think, over the next few years. In the UK and in Northern Ireland, we are faced with finding 3% real cash efficiencies year on year for the next 3 years. So we're taking 10% virtually out of our health and social care system through improved efficiency. And for that to happen, there is a need to ensure that managers and clinicians have access to timely information about their performance. So that's a key and critical driver. Another issue is really on the supply side factors, and what I mean by that is the changes in medicine that are happening. I think we all know the received wisdom is that people who are acutely ill have a better chance of a better outcome for their condition if they are treated in large acute centres which have access to the whole panoply of acute services on a 24/7 basis. So there's a concentration of acute services on fewer sites, and that immediately then challenges the sustainability of local services and raises issues in the public domain about accessibility. So the Connected Health agenda can help that by connecting local institutions with the major centres and providing access to specialist opinions remotely. Another supply side factor is associated with the demographic trend. When, if we continue providing care in the way that we're doing at the moment, we simply won't have the resource, the clinical resource, in order to deal with that demand. So we have to find different ways of working. And then there's the increasing demand, the demographic factor, which, again, not unique to Northern Ireland. We're all facing that. In Northern Irish terms, we're facing a doubling of the over 85 population in the next 20 years. We're already feeling the impact of that. We've had a 25% increase in the last 10. And this partially explains why, despite significant increases in our resources, the public do not necessarily see, if you like, an improvement in services. It's because the demands are increasing year on year. But it's not only an issue about numbers for us, there's an issue about resource. Our demographic trend is actually steeper than the English average, and our funding will be linked to the English average. So we have a real financial issue here, which is driving us to adopt new working practices. So we agree really with the European Commission that the way healthcare is presently delivered has to be deeply reformed, and that the current approaches are not sustainable. So, and we think that the solution in this is to seek the scale application of new ICT solutions. But it's not just about introducing the technology, it's about organizational change and new ways of working. So our response, our policy response to that context is really to push towards earlier intervention, pursue public health promotion and disease prevention strategies, development of early intervention strategies, looking at alternatives to hospital admission, new ways of improving and managing the way we manage demand, and better use of ICT. Now, why? We think the case is very clear on this. And a rational response would be yes to do this. These new arrangements should, inverted commas, fly. But the market isn't responding. When I say the market, the healthcare market isn't responding to rational argument. So we feel that a clear strategic focus is needed, using public authority really to address the obstacles to the fast introduction of these new technologies. So what have we done? Well, on the 22nd of January, the Ministers for Health and for the Economy came together and announced the establishment of the European Centre for Connected Health to give the strategic emphasis on this area and a strategic push within Northern Ireland. Now, we know that in pursuing that agenda in Northern Ireland that we are also helping to address the European agenda, and we want to be as helpful, I think, to our friends and colleagues in Europe in this agenda. We know there are obstacles. If we can, in Northern Ireland, demonstrate the case for the application of these technologies, we want to do that. If we can work with our colleagues in Europe and form collaborative partnerships to address some of the issues, we want to do that. So hence the European nature of our activities. To make this work, we need money. There is no point in standing from the sidelines and encouraging our health and social care system to adopt these new technologies unless we actually create an environment in which they can pursue them. So alongside this initiative is a significant investment in chronic disease. We will be spending about 50 million euros over the next 3 years in chronic disease management, and a significant proportion of that will be made available to support the introduction of telemonitoring and remote monitoring. In addition to that, we're about really to announce contracts for the rollout of night packs throughout Northern Ireland. I know that's not new technology, but what is unique, I think, or potentially unique, is that the system will be connected. This is not just about introducing our PAC systems within our hospitals. It's about joining up our hospital systems and our primary care systems so that images can flow throughout the region. And that opens up real potential